Breast cancer treatment research shows it is possible to administer less therapy to achieve similar or perhaps better cancer control outcomes. If you have watched the other videos on my channel, you would be aware that the latter is possible if breast conservation treatment rather than mastectomy is used whenever appropriate. In this video, I will be exploring the data on whether radiotherapy should be applied after breast conserving surgery. It is really exciting news, so stay tuned to find out 5 crucial questions a patient might want to ask if she wishes to consider avoiding radiation treatment. At this point, I want to thank everyone who has watched, entered comments, and subscribed to my channel. It's through your engagement that I get ideas about what content to create. Among all the comments that you have so kindly entered, there was one about radiotherapy, so this video has been produced in response to your comments. Please bear in mind that this is purely for educational purposes, and I do urge you to consult your doctor for a detailed discussion relating to your unique circumstances. Those of you who have followed my channel for some time would be aware that I am a breast surgeon. Surgeons work closely with both medical and radiation oncologists. While I do not specialize in radiation oncology, in order to ensure that my patients receive the best care they deserve, I keep abreast of developments in the field. So, in this video, I will share what I think women with breast cancer should know about radiotherapy and how it relates to breast conservation treatment. There are 5 questions a patient may wish to ask if she is considering omitting radiotherapy after breast conserving surgery. The first question would be why radiation treatment is usually administered after breast conserving surgery. This provides the basis for understanding current standard treatment. The next question to ask would be what type of cancer she has been diagnosed with. Currently, omitting radiotherapy is only suitable for women who are diagnosed with early breast cancer, which might be either ductal carcinoma in situ, also referred to as DCIS, or early invasive breast cancer. For women with DCIS, the question which follows would be, what are the other considerations? If a patient has early invasive breast cancer, then the questions to ask would be fourthly, what patient factors need to be considered? And fifthly, the tumor characteristics that are relevant for evaluation. At the end of the video, I will summarize the criteria used to make treatment decisions about radiotherapy and de-intensification of treatment for breast cancer, so I hope you will stay until the end for these important details. As mentioned, we need to first ask the question, why is radiation treatment usually recommended after breast conserving surgery? Let us look at the research data available to answer this question. This study, referred to as NSABP B06 by Professor Bernard Fisher and his colleagues, was one of the pivotal studies which led to a paradigm shift in the surgical treatment of breast cancer. In 2002, he published his 20-year follow-up of patients who participated in the study. Women who had invasive breast cancer, which were 4 centimeters in size or smaller, were stratified into 3 groups. The first group consisted of those with lumpectomy and axillary dissection without radiotherapy. The second comprised those who had lumpectomy, axillary dissection, and whole breast irradiation, and the third group was formed by patients who had total mastectomy and axillary dissection without radiotherapy. One of the key findings of this study was that local recurrence was lower in the group treated with lumpectomy, followed by breast irradiation, than in the other 2 groups. It would be worth noting that this study was performed before widespread breast screening was introduced. With the introduction of mammographic screening, cancers were being diagnosed at an earlier stage, and a higher proportion of patients were diagnosed at a stage referred to as ductal carcinoma in situ, abbreviated as DCIS. It is breast cancer which is so early that it is confined to the ducts and has not acquired the ability to invade surrounding tissue and spread. This 2016 article provides us with some historical insights into radiotherapy for DCIS. In the 1980s and 1990s, clinical trials found that following breast conserving surgery, abbreviated as BCS, adjuvant whole breast irradiation, or WBI for short, resulted in a roughly 35 to 45% reduction in local recurrence. More recently in 2025, this reduction in local recurrence was further corroborated by this team of doctors who stated that postoperative radiotherapy after breast-conserving surgery in node-negative early breast cancer not only reduces the risk of local recurrence substantially, but may confer a modest improvement in breast cancer-specific and overall survival. So we know that following breast-conserving surgery for early breast cancer, radiation treatment reduces local recurrence by up to 45%. There is also a potential for radiotherapy to offer an improvement in breast cancer-specific survival and overall survival. That is the reason radiotherapy is usually recommended after breast-conserving surgery. However, there is continued research to find out if it is possible to select patients at low risk of recurrence who may not benefit from undergoing radiotherapy. So the next question to ask would be what type of cancer a patient has been diagnosed with, whether it is DCIS or early invasive breast cancer. If it is DCIS, it would be necessary to evaluate the biosignature DecisionRT. What is this? Let us review this study, which helped us understand the utility of DecisionRT. We see that the DecisionRT biosignature combines biomarkers with clinico-pathological factors and reports a continuous decision score, or DS for short, on a scale from 1 to 10. Key excerpts from this study show us that the DS threshold was 2.8. Radiotherapy benefit was significant for patients with elevated DS, higher than 2.8, but not in patients with low DS. Understanding this information, a patient with a low decision score on DecisionRT may choose not to receive adjuvant radiotherapy. We move now to invasive cancer. If the diagnosis is invasive breast cancer, these are the questions which need to be answered. This is the summary of the research data, which helps us understand the patients for whom radiotherapy can be safely omitted. In this study, published in 2025, the research team found that women aged 65 years or older with estrogen receptor positive invasive breast cancer, which is smaller than 2 centimeters in size without spread to the lymph nodes, have a low risk of recurrence even in the absence of postoperative radiotherapy. The data, therefore, suggests that patients with invasive breast cancer are at low risk of recurrence if they are older than 65 years of age and on hormone therapy after breast-conserving surgery. In addition, the cancer should be hormone receptor positive, grade 1 or 2, of a size smaller than 2 centimeters without any lymph node involvement. If all these factors are fulfilled, it may be possible to consider omitting radiotherapy. In summary, therefore, doctors are constantly working to safely select patients who may be eligible for a reduction or de-intensification of treatment where possible. In the case of breast cancer, these are the criteria that are currently used to select patients at low risk of local recurrence after breast-conserving surgery and for whom radiotherapy may be safely omitted. For women diagnosed with DCIS, a decision score of lower than 2.8 on DecisionRT indicates a low risk of recurrence. For invasive breast cancer, patients should be older than 65, treated with endocrine therapy after breast-conserving surgery, with a hormone receptor positive, grade 1 or 2 tumor of a size smaller than 2 centimeters and no lymph node involvement. If all these factors are fulfilled, a low risk of recurrence is expected, and it may be possible to consider omitting radiotherapy. Please check with your doctor if this is applicable to you. Thank you for watching this video until the end. As always, I encourage you to check the references for yourself to verify the facts we use for evidence-based care. Kindly like, share, comment, and subscribe if you have found the contents helpful. Other videos in this channel cover other subjects on breast cancer surgical treatment, and I hope you will join me there too. Until we come together again, take care.